We are here in Dr. Muhammad Wasim Ma'az Hospital, one of the biggest and most important hospital in north of Syria. This hospital is providing secondary health services in all medical specialties for over 1.2 million beneficiaries in northwest of Syria. This hospital is considered to be the endpoint and the referral hospital in north of Syria. IDA is providing comprehensive health services through its hospitals and primary health care centers. And after 8 years of the humanitarian work, the existence of health information management system has become very urgent need in our work. And we are here to talk about this system that has been applied in Independent Doctor Association. The digital transformation is considered to be a key factor of the progress in any institution. Since 2016, IDA has worked on changing the paperwork and documentation into an electronic and automated system. And in 2022, we reached the point of almost zero paperwork in all our departments and centers. Our strategic objectives of this digital transformation are: 1. Unifying the health information system in all IDA's facilities. 2. Establishing the core of health information management system to build on in the future. 3. Using the available data for developing the governance in the future. This system had its implication on the organization and the beneficiary in the same time. First, the old paperwork system has been replaced with a cutting-edge system for data collection. Second, the system has enabled the health service providers to access patient data and the previous history. Third, the system is unified in all IDA's facilities, which gives the possibility to know all patient data in all IDA centers. Fourth, the physician can know in any time the availability of resources so he can secure the appropriate treatment. Fifth, the pharmacist can follow up on the pharmaceutical work and know the availability of drugs either in the pharmacy or in the warehouses. This system is a combined effort of all IDA staff in program and technical departments, which information unit has transformed it into this product. And the information unit will provide you with a comprehensive information about this system later on.
We built this product from scratch, taking into consideration all the lessons learned from the similar project. We used the latest available technology that is provided by the leading companies such as Google and Facebook to obtain high quality and great performance. This system has two versions, mobile and web application. Both of them are working online and offline. We focused a lot on the user interfaces to create user-friendly app and high user experience. Taking into consideration only the necessary information, we minimized the input as much as possible. We depend only on multiple choice, autocomplete and checkboxes instead of open question to speed up the process. The data flow starts when the patient came to the facility. The receptionist searched for the patient file or create a new one. After selecting the required clinic and printing the queue paper, the doctor sees the patient queue inside the app. By selecting the patient, he can explore the patient history. After doing physical examination and the required test, the doctor fills in the medical information and prescription into the system. The session is closed when the pharmacist gives the medicines to the patient with instruction. The data flow does not end when the patient leaves the facility. It starts a new phase with the meal department.
Hello everybody, we are here in meal department at IDA in Turkey. Now we will talk about health information management system and what is the benefit from meal point of view. A health information system enables healthcare organizations to collect, store, manage, analyze, and optimize patient treatment history and other key data. The system also enables healthcare providers to easily get information about microenvironments, such as community health trends. It ensures the patient records is accurately and timely, and ensures the privacy and confidentiality. We will see the results of analyzing the HIMS data on Power BI divided into several pages. For example, we will choose any health facility to see a summary of patients' information in general, such as number of consultations, number of individuals, gender, age groups, number of diagnoses by gender and age groups, and etc. The system enables us to know a deeper analysis, which is to follow up on diagnosis in different health facilities, according to the demographic information of patients. Here, this information about gynecological disease that are presented according to the categories such as ANC and BNC and their frequency. And the number of referrals also by demographic information, accommodation, diagnosis, facility name, and type of clinics. Here we can find out the diagnosis by gender, the name of the facility, and the type of clinics as well. In a more profound stage, which is the most important stage, where we can link the health facility, clinics, and diagnoses described in each clinic with the drugs prescribed for these diagnoses and the quantities of drugs down to the patients. This tracking enables us to compare the difference between the diagnosis within health facility and the drugs used to treat each diagnosis, and also between health facilities in general, where the medical reference can verify the prescriptions and diagnoses given in the health facilities and issue corrective instructions based on this data. Additionally to what we mentioned previously, this system enables us to conduct data analysis beyond medical services and protocols. The importance of this system for the department comes from the analyzing the HIMS data to get a deep and comprehensive information.
This system aims mainly to serve the beneficiary and to promote health system in Syria. IDA tried to build a system in line with the international standard health systems as part of its efforts to reach out better governance in the health sector. Thus, we can say that IDA has become one of the leading organizations implementing automated health system among other organizations working in Syria.